Good evening. Jai Jagannath. Shamastungu Namaskar. Pranam. Today we are going to organize 127th National Webinar, and this live webinar is organized by the Rover Ranger Unit, Mo College ABHIYAN of Maharshi College of Natural Law in collaboration with Cancer Center, Apollo Hospital, Bhubaneswar. नीलाद्रौ शङ्खमध्ये शतदळ कमले रत्नसिंहासनस्थं सर्वालङ्कारयुक्तं नवघनरुचिरं संयुतं जाग्रदेन भद्राय वामभागे रथचरणयुतं ब्रह्मरुद्रेन्द्र वन्द्यं वेदनं सारमेशं स्वजन परिवृतं ब्रह्मदारु स्मरामि परम कारुणिक अनंत कोटि ब्रह्मांडर मौडमणि कोटि कोटि ओडियांकर हृदयर आराध्य देवता समग्र विश्वचराचरर स्रष्टा आनंदकंद परमानंद सचिदानंद अखिल रसघन विग्रह विश्व वेदनार वैद्य देवाधिदेव श्री श्री जगन्नाथंकर चरण कमल रे कोटि कोटि धन्यवाद. Respected Principal Dr. Nalini Prabha Mohapatra ma'am, the president of this webinar, esteemed Dr. K.P. Misesa, the vice president, Bharat Scouts and Guide, New Delhi, and the state chief commissioner, Odisha State Bharat Scouts and Guide, the patron of this webinar, revered chief speaker, our beloved madam, Dr. Sthiti Das, the radiation oncologist, Apollo Hospital, Cancer Center, very well known, very young, very energetic, and full of enthusiasm. My dear Sushri SNEHA HALDAR, student of Zoology Honors of Maharshi College of Natural Law, and all my respected viewers, media personnel, and viewers from other than Odisha State, like Salima, Vijaya Madam, Roma Ma'am, and so on and so forth. This month, October, as all of us know, it's well known for all of us because it is the month of awareness for breast cancer, for which different units of Maharshi College of Natural Law, like Rover Ranger Unit, Mo College Unit, and all the students is organizing such a live webinar along with the full cooperation of our PRO, Apollo Hospital. He is none other than Anupam Jaina. I, on behalf of Maharshi College of Natural Law, Dr. Namita PATNAIK, the coordinator Mo College ABHIYAN, and the Assistant State Commissioner Guide Bharat Scouts and Guide, being the host and convener, welcome to all of you to this Google board. It's my proud privilege to welcome our chief speaker, Dr. Sthiti ma'am. Let's welcome him virtually.
Thank you so much, ma'am, for the opportunity, and I must say it was a very generous introduction. I'm really privileged to be amongst you and to spread some words of awareness about breast cancer. As you all know that October is being observed as a breast cancer awareness month every year. And in the introduction, you were also telling me that you people also in your college have also organized some activities.
Madam, just for 1 minute. This is a virtual video play for you. I think you might have seen this one. Okay. So now it's my time. Just before starting the program, I always believe in God, and we, the Bharat Scouts and Guide, Mo College, and all of us being Indian, we believe in God. So prior to that, I request DIBYANSHU, one of our junior most viewer, to enchant the SLOKA, followed by Madam Dr. Das' speech. So now I'll request DIBYANSHU. Are you there, DIBYANSHU?
Yes, ma'am.
Yes, please.
Namaskar, ma'am.
DIBYANSHU, video, please. You are muted.
Sorry. Namaskar, madam. वक्रतुंड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा ओम श्री गुरुभ्यो नमः ओम श्री परमात्मने नमः अथ श्रीमद्भगवद्गीता अथ प्रथमोऽध्याय अर्जुन विषाद योगः धृतराष्ट्र उवाच धर्मक्षेत्रे कुरुक्षेत्रे समवेतायुयुत्सव मामका पाण्डवश्चैव किम कुर्वत सञ्जय सञ्जय उवाच दृष्ट्वा तु पाण्डवानीकं व्यूढं दुर्योधनस्तदा आचार्यमुपसंगम्य राजा वचनमब्रवीत् पश्चैतां पाण्डुपुत्राणामाचर्यमहतीं च मूं व्यूढां द्रौपदपुत्रेण तव शिष्येण धीमता अत्र सुरा महेश्वास भीमार्जुनसमायुधि युयुधानो विराटश्च द्रुपदश्च महारथा अस्माकं तु विशिष्टा ये तानि विजोत्तमा नायका मम सैन्यस्य सैन्यार्थतान् ब्रवीर्मिते ओम नमो भगवते वासुदेवाय नमः।
Thank you. Thank you so much, Dibyanshu. So, as all of you know, the theme of the webinar, that is health awareness campaign, stamp out the breast cancer. So, most common type of cancer of women at a skin cancer. Unfortunately, although there are many ways it can be treated, breast cancer is incurable, and scientists are not exactly sure how to prevent people from developing in the first place, and in effort for the better understanding this disease, how it can be cured both individually and by the non-profit organization just like us, we have taken it up as a mass campaign. So campaign does not mean that for one day or for 1 month, it's forever. So for that reason, I'll request to all of you, on particularly on the month of October, please wear the pink color. Why pink color? That will be explained you by Dr. Ma'am. And pink color is a symbol of our breast cancer. How to the survivor, कितने भी बच्चे गए वो लोग के लिए, हमको याद करने के लिए, वो लोग के लिए काम करने के लिए हमको ये वेयर पहनना है, तो इसलिए पिंक कलर को याद रखिए. Then the millions of people who have heard this disease, many have taken the time to share the thoughts and insight with the world. So one or two I'll just share. One of Mr. Jane Cook, she told breast cancer changes you, and the change can be beautiful. So once I overcome breast cancer, I was not afraid of anything anymore. So mark the words. So next time when we'll be here, we'll request one or two members, those who have been operated and they have been cured by the for this, and they will share their experience. So now I'll request our ma'am how to fight each round and take it on the chin and never, 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 ever give it up. So let's listen from Dr. Sthiti Das. Over to ma'am, please. Ma'am.
Thank you so much. Without wasting much time, we'll straight away go to the topic.
Sure.
So as we all know, this month of October is observed worldwide as a breast cancer awareness month. Hence, we all have come here to discuss the pertinent points. So my topic is like understanding breast cancer, and we should always be more aware of what will be the signs and symptoms or what will be the risk factors, and we shouldn't be alarmed. So coming to the, before getting into the, we can first discuss what will be the global scenario for breast cancer. As we all know that every year 1.5 million cases are being diagnosed. For women, it is the most common cause of cancer. Mortality wise, it is also a very common cause of death in women. But despite the incidence, the 5-year overall survival globally, if you see, it has increased and it is like around 90%. But if we go by the Indian scenario, even if the annual cases or the incident cases are less in comparison to the global scenario, but it is still the most common cancer in urban India, most common cause of cancer-related mortality, but 5-year survival is very low, that is 50%. Here, actually, I would like to mention that this is not because we do not have advanced treatment techniques, but this is because there's a lack of an awareness in our country about the disease. And more often, we do not get patients in the early stages. We get to diagnose them in the late stages. And that is the reason this campaign is very important, where we need to spread the message that the early will be the diagnosis, in the early stages, the diagnosis can be done and the treatment will be more and more successful. And so we also can increase this overall survival, 5-year overall survival to up to 90% if it is diagnosed in stage 1 and 2. So what causes breast cancer? We have college going students here. I'm sure they must be knowing the word cancer, the meaning of the word cancer. It is caused by genetic abnormality, and this abnormality in less than 10% of the cases is inherited. Mostly this abnormality is sporadic and it occurs due to the normal wear and tear of life and because of aging process. So this mistake in genetic material causes the cells to become dysplastic and cancerous, and these tumors then grow, and there is a proliferative growth which does not stop, and it may also spread to the other organs. So coming to the anatomy of the breast, we all know this breast is sit on the chest muscles. It consists of 15 to 20 lobes. These lobes contain smaller lobules, and lobules contain groups of tiny glands. You can see here tiny glands which secrete milk, and this milk flows through the tubes. So mostly which we encounter in our practice is the cancer which arises from these ducts and rarely from the lobules. So knowing the anatomy is important because we need to know from where the cancer is arising. So as I mentioned, ductal carcinoma is the most common variety of cancer we encounter, which originates from the ducts. If it is confined to the duct, it is known as a DCIS, or if it is spread beyond it, it is known as invasive cancer or infiltrating cancer. Lobular carcinoma is another variety which is usually rare. So coming to the risk factors of importance for breast cancer, we should know how we can, though we know we cannot prevent it, but we can actually decrease the risk of getting breast cancer. There are some modifiable risk factors on which we can work on, but there are also some non-modifiable risk factors which we cannot do anything about. So the first and most important risk factor is the gender. Being a female itself is a risk factor, but that doesn't mean males are immune to the disease, because there are 1% of males which can be affected with breast cancer. In the race, the most common are whites who are affected, rather than the Afro-Asian subgroup. Age, as a woman gets older, the risk factor increases. Usually, if you would ask me a decade earlier, like mostly 35 to 45 age group and onwards, we used to get affected. But now there is a slight shift, and even we are seeing patients in the age group of 20 to 30. Family history is very important, like mother or sister, if she has breast cancer, then we have an increased risk of getting breast cancer. So a genetic counseling is very important in these cases. Coming to menstrual history, if the length of the reproductive cycle, the more is the length of the reproductive cycle, where there is early onset of menses or there is a late menopause, then it may increase the risk of getting breast cancer. Coming to childbirth, first childbirth after the age of 30 or nulliparous women, they have an increased risk of getting breast cancer. Similarly, pregnancy and breastfeeding, they decrease the risk of getting breast cancer. Coming to the hormonal risk factors, you can see here early menarche, late menopause. That is, the length of the reproductive cycle is very important. Nulliparous women, pregnancy more than the age of 30 years and no breastfeeding. And if there is a prolonged hormone replacement therapy which has been used, use of hormones more than 5 years, they increase the estrogen exposure in the body by 1.5 and they increase the risk of getting breast cancer by 1.5 to 2.5 times. So coming to the other risk factors, which is the modifiable risk factors like obesity, the more the percentage of fat in the body, it increases the risk of getting breast cancer. A fatty diet, more of alcohol, this also increases the risk. Lack of physical activity, stress. If there is any history of radiation exposure due to other diseases like lymphoma to the chest or thorax, this may also be a risk factor. History of cancer, as I said, there is a familial history or there is history of cancer in other areas like uterus, cervix, ovaries. Hormones like estrogen in hormone replacement therapy and birth control pills, also they have a correlation. There may be an increased chance of getting breast cancer. Coming to genetics, as I discussed, there may be a genetic predisposition also where we need to do a thorough genetic counseling. And if we see more than 70%, they have no risk factors at all. So if we go, that if we can decrease the chances of getting breast cancer, so some factors which can be controlled are, we can see in this slide, obesity, not having children, breastfeeding is definitely protective for breast cancer. Usually we recommend that a woman should breastfeed up to 2 years. Exercise, should avoid a sedentary lifestyle. At least 30 minutes of exercise every day, 5 days in a week is recommended. We should avoid hormone replacement therapy, and one is alcohol, avoiding alcohol. So these are the risk factors which we can work on, which is the modifiable risk factors, that we can try and regulate the risk of getting breast cancer. So all said and done, the good news is majority of breast lumps are not cancerous. The majority of breast lumps we encounter in our daily OPD practice, 80 to 85% are diagnosed as benign. And usually if we see less than 30 years of age group, we encounter a benign breast lump. Common causes of lumps are fibrocystic changes in elderly women or premenopausal women, fibroadenoma in teens, cystic changes or fibroadenocystic changes in 30s to 40s. These are the normal benign conditions we encounter in breast. So the moment we encounter a breast lump, we should not think that this may be cancerous. It's very obvious that we should get it checked with the physician, and if there is suspicion, we can get other tests done. But we should not panic at the first minute that no, this may be cancer. Most of the time, it comes as a benign breast lump. So the common non-cancerous conditions we encounter are, this was discussed in the previous slide, fibrocystic changes, cysts, fibroadenomas, infections, and last is trauma. Even if there's some trauma or blow to the breast, a bruise can be seen as a lump. There may be some infections where the breast may appear slightly red, warm, tender, and lumpy. So usually it may present as a lump. And like I already mentioned, fibrocystic changes, cysts, and fibroadenomas, they also present as a lump, but normally there are benign conditions. So what will be the warning signs and symptoms of breast cancer? The most common is a lump or a thickening in the breast, as we can see in the first picture. Lump or thickening in the breast, not only on the breast, but also in the underarm area. Sometimes we may see there will be no lump in the breast, but there will be a lump in the underarm area. And most often it is painless. That is the reason it tends to get missed, because of its painless nature. Most of the times in the OPD, when we are sitting and we are encountering patients on a daily basis, they come running to us because they have a painful lump. But that is where we need to understand a painful lump mostly comes as a benign. But if it is painless, we should be more cautious and we should always get it screened or get it investigated, that whether it is actually a breast lump, benign or malignant. So first and foremost, we need to understand that the most common symptom is a lump or thickening in the breast. It may also present in the underarm area, even if not in the breast, but this is rare. The next symptom is discharge or bleeding. Any nipple discharge, which is consistent is there for about more than a month. It may be bleeding, it may be serious discharge or a prolonged discharge also. We should not neglect it. Third symptom is a change in size or contours of the breast. If you see the contour of the breast, there may be some change in the contour of the breast or size of the breast. It should be also taken into consideration. It should not be neglected. This is another symptom. Third is the inversion of nipple. If there is a recent change or inversion of the nipple, because sometimes we see patients who tell it may be a congenital thing also. But if there is a recent inversion of nipple, it should not be neglected. This is another important symptom. Fourth is the change in color or appearance of the areola or crusting. Crusting the areola is also important sign and symptom because it points towards Paget's disease of the nipple, which is also a malignant condition. And last is the redness or fitness of skin, thickening of the skin over the breast. There may be no clear defined lump, but whole of the breast may appear red, and there may be pitting, which may mimic the skin of an orange, which is also known as a purely orange appearance. It may look like the skin of the orange, it will be red, it will be warm, there will be pitting, and there will be no well-defined lump in the entire breast, but the entire breast will be swollen and red. So these are the very important slide. These are the signs and symptoms you must remember, which may point towards a malignant lump. So the most important question which arises is some women in this crowd may have early cancer. How can we detect it? So there comes the role of screening, where an unsuspecting population, we do a certain number of tests on these unsuspecting population so that we know there are some signs and symptoms of cancer or not. So screening for breast cancer comprises of 3 main tests, which is first and foremost with the monthly self-examination or self-awareness of breast self-examination. It starts from your home. We all know charity begins at home. So this breast awareness or a breast campaign which we are running, which also begins from your home. So this is a very important test, breast self-examination, which starts from your privacy of your own homes, and you can do it once in a month, followed by a clinical breast examination. If there's a suspicious nodule or a lump, you can get it done, examined by clinician. This is another screening test. And last is the mammogram. This is the type of X-ray of the breast which is done to diagnose or screen breast cancer in women. So coming to breast self-examination is the opportunity for women to become familiar with her breast. Monthly examination is done for the breast as well as the underarm area. It may discover any changes early because more and more you are familiar with the tissue, with the consistency of your own breast, the earlier you can diagnose if there are any changes and you can get it investigated. So it can be begun at the age of 20 and it can be continued monthly, once in a month. So for menstruating women, the guidelines are 5 to 7 days after the beginning of their period. For menopausal women, same date of each month. You have to mark a date in the calendar. Each month, on the same date, you have to do the examination. For pregnant women, also same date each month. It takes around 10 minutes and it can be done once in a month. You have to examine all of the breast tissue and the underarm area. So this is a very important slide which shows in both the positions. One is the lying down position, one is the standing position. So in the lying down position, you have to put your left. Always remember, you have to take first 3 fingers and the middle part of the first 3 fingers needs to be used to palpate the breast. You have to lie down and put your left arm under your head. Use your right hand to examine your left breast. With your 3 middle fingers, just like I mentioned, 3 middle fingers flat, move gently in small circular motions over the entire breast, checking for any lump, hard knot, or thickening. Use different levels of pressure like light, medium, and firm over each area of your breast. Check the whole breast from your collarbone above your breast, collarbone down to the inferior extent to the ribs below the breast. Switch arms and repeat on the other breast. You can do it in a clockwise direction and each area should be palpated. Coming to the second position, look at your breast while standing in front of a mirror with your hands on the hips. You need to look for lumps or any changes in the size or contours of the breast, and if there is any swelling or dimpling of the skin. Sometimes if you see examine the standing position, you may see there may be certain dimpling or changes in the skin itself. Then you can raise one arm, then the other, so you can check under the arms for the lumps. Lastly, you need to squeeze the nipple of each breast gently between your thumb and index finger. And if there is any discharge, you need to report to your clinician or any healthcare provider about any abnormality. So coming to the next screening test, that is a clinical breast examination. It is always performed by a doctor or a trained nurse practitioner. As per the guidelines, annually for women over the age of 40 years, at least every 3 years for women between 20 and 40 years. So more frequently it has to be done. It has to be started at least from the age of 30 years for high-risk patients, like I mentioned, for having known risk factors or having breast cancer in the family and their mother on this sister. So coming to mammography, it is an X-ray of the breast which has been shown to save lives in patients around the age of 50 to 69. Normal mammogram does not rule out the possibility of cancer completely, but it helps us to detect malignant lungs. As per the protocol or guidelines, women 40 years of age and older should have a mammogram every year. Every year we need to do a mammogram for patients 40 years of age and older. So this is a very interesting slide. If you see a noticeable lump or an occasionally when you see the lump, the size is usually around 3.6 centimeter. But if you're doing a routine breast self-examination, you're routinely doing it, then a size of 2.1 centimeter lump can also be diagnosed with breast self-examination itself. With occasional mammogram, we can diagnose it of the size of 1.5 centimeter, and with regular mammo, we can diagnose it with the size of 1.1 centimeter, as small as 1.1 centimeter. So even if we are doing a routine breast self-examination, if a 2 centimeter lump is palpable, then that means we can be able to diagnose the disease at a very early stage. So once the screening is done and then we come across a lump, there is a lump and a patient has come to you with a lump, then what all tests you need to do to confirm the diagnosis? We need to do a mammogram, just like I mentioned. It is an X-ray of the breast, which with the Virat scoring, there is a scoring system in place which helps us to diagnose whether it is malignant or not. Scoring 4 and above are more suspicious of cancer. Next is an ultrasound is done mostly in young women. If there is a dense breast, usually we avoid a mammogram. In less than 30 years of age, an ultrasound is done to see if there is a lump. And lastly, to confirm the diagnosis, a needle biopsy is done, where a tissue is removed from the lump under ultrasonic guidance, and then it is studied under the microscope to see if there are cancer cells present. So the diagnostic workup, just like I mentioned, in younger than 30 years of age group, ultrasonography is the preferred initial evaluation method. Older than 30 years, diagnostic mammo is done, and after both of this, biopsy is warranted in almost all circumstances to prove the diagnosis of cancer. Coming to breast cancer staging, once the diagnosis is done, breast cancer staging is a very important tool. It is a way of describing the cancer, and it is mostly done by the TMM staging, which is the tumor, T for tumor, N for spread to the nearby lymph node, and M for metastasis into the other solid organs or any other bone or brain. So once we diagnose the tumor, we always have to do the staging, because once the staging is done, then only we can plan the treatment and prognosticate the patient. So the type of a treatment a person receives depends on the stage of the cancer. So this slide actually shows that as per the size of the tumor and the presence of lymph nodes, the staging is done into four stages. And if you see the first two stages, stage 1 and stage 2, the 5-year survival is very, very high, around 80 to 95%. For stage 3, it drops down to 55%, and for stage 4, it is around 20 to 30%. So there lies the importance of staging the disease, because in the early stages, the earlier you detect the disease, more will be the chances of survival. So coming to breast cancer, I'll just swiftly run between these slides. Mostly we see there are 4 stages. Stage 1 is a breast cancer that is very small, less than 2 centimeter size. Like I mentioned in the previous slide, that if we are doing a regular breast examination also, we will be able to diagnose the disease in a very early stage, which is stage 1. So a 2 centimeter lump can be palpated if we are doing a routine breast examination. So a tumor which is less than 2 centimeter and does not spread to the lymph nodes is stage 1. Tumor which has crossed the size of 2 centimeter, 2 to 5 centimeter, and it has gone into the lymph nodes is stage 2. Stage 3 is more than 5 centimeter tumor, and it has between 2 to 5 centimeter tumor, and there are multiple lymph nodes in the regional area. And if there is chest wall invasion also, chest ulceration also, it is categorized as stage 3 breast cancer. Stage 4 is tumor of any size which has spread to the distant sites like bones, lungs, liver, or chest wall. So this is a stage 4 breast cancer where the survival drops down rapidly to 20 to 30%. So how to fight breast cancer? Once the staging is done, in our armamentarium, there are many methods starting from surgery, chemotherapy, radiotherapy, where we can treat the disease. Surgery is the first and foremost treatment we usually offer to our patients. Mostly in early stages, we go for surgery. Usually, mastectomy or lumpectomy is the options given. But the good news is that we can also conserve the breast, and lumpectomy may be tried for women in comparison to mastectomy, and both the treatment have equal or excellent results. So we also need to know that the surgical aspects are advanced, and we can also treat the patients with a lumpectomy followed by a breast irradiation is done usually, so that we can conserve the breast. Next treatment is chemotherapy, which is usually done by the use of chemotherapeutic agents which are injected intravenously. Usually after surgery, after seeing the histopathology report, we recommend chemotherapy for these patients. And after some 6 to 8 cycles, then as per the indications, the patient is then taken for a local radiotherapy for the chest wall or the breast. And because of like very advanced linear accelerators, like at our center we have the TrueBeam HCS machine, which is a very advanced linear accelerator. We can treat the breast tissue, the chest wall tissue, and we can preserve the cosmosis of the breast without having any side effects to the vital organs like heart and lungs. Followed by hormonal therapy. As I said, it is a hormonal dependent disease. So depending upon the estrogen receptor and progesterone receptor status, we can also offer a number of hormonal agents which can help us to curb the disease. There are also many novel treatment strategies like targeted therapy, where HER target can be targeted with some biomap, some immunomodulatory treatment also can be given. Targeted therapy also can be offered to the patients, where targeted therapy is much more safer than chemotherapy because it only acts on the HER2 target. So there are many types of therapy which we are offering to our patients in breast cancer, where we can actually prolong the survival. And for stage 1 and stage 2, as I showed in the earliest slides, the overall survival can go up to even 95% if they are diagnosed and treated properly. So I'll just come to the end of my presentation that I'm fine today and stronger than before. I credit to early detection, which was told by Olivia Newton-John, who was diagnosed in 1992 with breast cancer only through breast self-examination. So now we know breast self-examination plays a very vital role for all women. And those who are listening to me right now, they should also understand that we also have to spread this message and at least educate 5 to 10 women back home. We have to go and educate them so that they also come to know the importance of breast self-examination. Thank you.
Thank you, ma'am. So cancer is a word, not a sentence. So there can be life after breast cancer. The prerequisite to what madam had told, that early detection. So may I request now, we are having friends Ayman Khatun, Aditya Rai, and Sneha. So, do you like to have any question? Yes, please. Unmute your video and then ask. Yes, Bismita, you can ask question. Introduce yourself, from which college you are. If you don't want to ask, you can write also in the chat box. Yes, Bismita, are you there? Bismita? Yes, she has written question. Ma'am, can you tell what is the symptoms of breast cancer and how we know a woman is affected in breast cancer? Okay.
Okay. And should I go back to the slide once again? Does she want to see the slide or I'll just tell here?
Yeah, just tell ma'am, because the slide is there.
And the symptoms I have already showed in the slide. The first and foremost, the most important sign is the lump, breast lump. Mostly it is painless, and this lump may be present in the breast as well as in the underarm area. We always tend to miss this because we always think it is in the breast, but breast is connected to the underarm because breast tissue also there is a axillary tail. Some of the breast tissue also goes under the underarm. So there also the breast lump can form. So breast as well as the underarm area. This is one important sign and symptom. There may be any discharge from the nipple. There may be any change of the contour of the breast, or there may be any dimpling of the skin. Okay, the skin may feel firm, or there may be any dimpling of the skin as well. Third is, I told you, there may be some crusting on the nipple. That is also one of the symptoms. And the last one is there is a generalized tenderness, generalized orange shaped skin of the breast. There is no well-defined lump, but the entire breast is red, warm, and feels like that of the skin of the orange. That's why we tell it pudgy orange appearance. So there will be no clear-cut lump, but the whole of the breast will be, that is known as inflammatory breast cancer. That is also a very rare tumor of breast cancer, but it is also seen. This is also an important sign and symptom. And if you come across such signs and symptoms, your first responsibility is to go and meet your clinician and get it investigated. If there is a mammography done, like I said, there are scoring systems for mammograms. If you're doing a mammogram, mammography tells they will give a certain scoring for those breast lumps. This scoring is known as breast imaging system, BRAD system, where this scoring is done from score number 1 to 6. 4 onwards, the suspicion increases. So once they are giving a scoring more than 4, then we need to again substantiate the diagnosis with a biopsy. This biopsy is done with a syringe or a needle. We can insert it under ultrasound guidance into the breast lump, and we can take out tissue and we can study it under the microscope to see whether cancer cells are present or not. So here the diagnosis gets confirmed.
Yeah, she has another question, ma'am. Ma'am, is breast cancer spread in cold climatic condition or cold?
No, on that,
No.
because the racial predisposition is there, the whites get, there is a tendency to for them to get affected more than us.
Yeah.
But the problem is even the incidence is high and incidence is low in our country, the survival rates are better for them but less for us. So this is where we need to work on the awareness part. The people should get aware about their symptoms. Whenever they're coming across such symptoms, they need to see their doctor immediately. They should not panic.
Yeah.
And this is a self-help strategy. We women need to first look at ourselves. We are always busy with the family. We are always busy with our husbands, with our parents, with our in-laws, with our children. We are always busy taking care of them. If we do not, we forget to do this simple test, which can be done once in a month. in the privacy of our own home, comfort of our own home, but we tend to forget.
Yeah.
So that is what is actually should we focus on, and our people who are our viewers are, our students are, they should go back and they should also educate 5 or 10 more people from their side. Then only this campaign will be successful.
Yeah. So breast cancer awareness is not just a month. Fighting breast cancer takes everyone. So everyone, just you have seen in the poster, it makes a difference. So I think awareness is power. So early detection saves life. So a cure worth fighting for. That means we have to make a teamwork, and one dream. Let's find a cure. That's so. In this regards, I'll request Sneha. Do you like to say something, Sneha? Sneha Haldar? Are you there, Sneha?
Yes, ma'am.
Okay. You want to say something? You have a very good discussion yesterday, so I like that. So can you share it within 2 minutes? 2 minutes.
Ma'am, regarding
That your poster and your talk. I want everyone should say see something. They should see and they should learn something. By the time we are having our principal ma'am, Dr. Nalini Prabha Mohapatra ma'am, the president of this webinar, she will speak the presidential address. Afterwards, Neha, you will explain, or you will speak for 2 minutes. Then we'll wind up. Okay, ma'am. So now I request our principal ma'am, Dr. Nalini Prabha ma'am. Yes, ma'am. You can address the gathering, ma'am. Yes, ma'am. Again, madam. हाँ मैडम सुना होची मैडम
ଗୋଟେ ଫୋନ ଆସୁଛି ସେପଟୁ ରାଜୁ ବାବୁ କରୁଛନ୍ତି
मैडम ओके मैम
ହଁ ହଁ
वेरेबल टू लिसन मैडम कुहंतु
କଣ ସେପଟୁ ଫୋନ ଆସୁଥିଲା ତ
आगे मैडम मैडम कुहंतु आगे
ବନ୍ଦ ହେଇଗଲା
हाँ कुहंतु मैडम
କମ୍ୟୁନିକେସନ ହେଇଗଲା ଠିକ ଅଛି ୱେଲକମ୍ ଆଜିର ୱେବିନାର କୁ ମୁଁ ସମସ୍ତ ଅତିଥି ଏବଂ ମୋର ପିଲାମାନଙ୍କୁ ସ୍ୱାଗତ କରୁଛି ଆଜି ମୋ କଲେଜ ଅଭିଯାନ ତରଫରୁ এই ୱେବିନାର ହେବାରୁ ମୁଁ ନିଜେ ଗର୍ବିତ ଅନୁଭବ କରୁଛି ଏବଂ ଆଜି ଆମର ମ୍ୟାଡାମ ଜଣେ ଅଛନ୍ତି ବୋଧେ ଡକ୍ଟର ମ୍ୟାଡାମ ଜଣେ ମୁଁ ଏହି ସାଙ୍ଗେ
स्थिति
ସାଙ୍ଗେ
मैडम स्थिति मैडम डॉक्टर स्थिति दास
ହଁ ନମସ୍କାର ମ୍ୟାଡାମ ଆପଣଙ୍କୁ ବହୁତ ମୋ ତରଫରୁ ଅନୁଷ୍ଠାନ ତରଫରୁ ଧନ୍ୟବାଦ ଦଉଛି ଯାହା ହଉ ଆପଣ ଆମ ଗହଣରେ ଅଛନ୍ତି ଆଉ ମୁଁ ଏଇ ହଠାତ୍ ମତେ ଡାକିଦେବେ ବୋଲି ମ୍ୟାଡାମ ମୁଁ ଜାଣିନି ଫୋନ ଆସୁଛି ସେପଟରୁ ଆଉ ଆପଣ ତ ଡକ୍ଟର ବହୁତ ବିଜି ଲୋକ ତଥାପି ଆପଣ ଏତେ ସମୟ ଦେଇଛନ୍ତି ଆଉ ଆମ ଗହଣରେ ଅଛନ୍ତି ଆଉ ଆପଣ ତାଙ୍କର ସବୁ କଣ ଆଜି କହିବେ ଆମେ ଶୁଣିବୁ ଆଜି ବୋଧେ ଟପିକ ଟା ମୁଁ ସେତେବେଳେ ଭାବୁଥିଲି ଆମର ବ୍ରେଷ୍ଟ କ୍ୟାନ୍ସର ଉପରେ ହଉଛି ଯୋଉଟା ଆଜିକାଲି ଗୋଟେ କମନ ଡିଜିଜ ହେଲାଣି ତେଣୁ ପ୍ରତ୍ୟେକ କମନ ଡିଜିଜ ଏଟା ହେଲାଣି ପ୍ରତ୍ୟେକ ଲେଡିଜ ମାନେ ବା ଝିଅ ମାନେ ବା ଓଲ୍ଡ ଲେଡି ବି ଏଟା ନିହାତି ଶୁଣିବା ଆବଶ୍ୟକ କାହିଁକି ନା କାହାର କଣ ହବ କେତେବେଳେ ଏଇ ରୋଗରେ ସେ ଆକ୍ରାନ୍ତ ହବ କିଛି କହିହବନି ତେଣୁ ଆପଣଙ୍କର ଆଜି ବହୁତ ଭଲ ପ୍ରୋଗ୍ରାମ ଟିଏ ମୁଁ ନିଶ୍ଚିନ୍ତ ଭାବରେ ଶୁଣିବି ଆଉ ମୁଁ ତ ଜଣେ ଫୋନ କରୁଛନ୍ତି ଏଇ ମୋବାଇଲରେ ଆମ ଷ୍ଟାଫ ତାଙ୍କ ସାଙ୍ଗେ କଥା ହେବି ମ୍ୟାଡାମ ଆପଣଙ୍କୁ ମୋ ତରଫରୁ ଧନ୍ୟବାଦ ଆଜିକାର ୱେବିନାରରେ ସମସ୍ତ ଅତିଥିଙ୍କୁ ଧନ୍ୟବାଦ ଆଉ ମୋର ଷ୍ଟୁଡେଣ୍ଟ ମାନେ ମଧ୍ୟ ଉପସ୍ଥିତ ଅଛନ୍ତି, ମୁଁ ତାଙ୍କୁ ସ୍ୱାଗତ କରୁଛି। ସେମାନେ ମନ ଦେଇକି ଶୁଣନ୍ତୁ ୱେବିନାର ଟି, ଏଟା ବହୁତ ଏଫିସିଏଣ୍ଟ ସେମାନଙ୍କ ପାଇଁ କାମ କାର୍ଯ୍ୟରେ ଲାଗିବ। ରହୁଛି, ଧନ୍ୟବାଦ।
Thank you, madam. Thank you so much. Now I request Sneha, please. Sneha,
Yes, ma'am.
okay, please start. Unmute your video. Yeah.
Ma'am, tomorrow we had made actually we are having a competition regarding the breast cancer. So I had made a poster in which I have explained very beautifully about how it causes, what are those symptoms, and also how we can diagnose that we are having breast cancer. And ma'am, I had also made a pink ribbon in where people generally wear the pink ribbon to honor the survivor and remember those who have lost their life in this disease, and to support the progress that we are making together to defeat the breast cancer. And as we know that October is a month in which we actually having our awareness campaign regarding breast cancer. So in our previous day, we are having that competition, and I explained that how it causes by not breastfeeding, and also by consumption of alcohol and intakes of drugs, and ma'am, by having a late pregnancy, these all are the main causes. And by the symptoms are those like we have to stand in front of a mirror, we need to press our breast in all the direction to check whether we are having any lump inside our breast or in our armpits. These are the symptoms. If we are having like discharge of blood or limp something from our breast, these are also the symptoms. And it was also suggested that those people or those women who are 20 year above, they should regular check about their breast. They should know about their breast status by standing in front of a mirror and check them. And if someone is having cancer, there are many ways to treat it and for diagnosis, like biopsy, like mammography, and also like ultrasounds. These are the diagnostic methods. And ma'am, thank you for giving us the opportunity to hear your thoughts today in this awareness campaign, and this will surely be going to encourage us in our future event. Thank you, ma'am.
Thank you so much. We are having our State Commissioner Guide, Mrs. Anamika Das. May I ask, ma'am, as you have already been there when we are having the cervical cancer webinar, and today we are having another cancer webinar, that is breast. That is very important for all of us. Being ladies, we should know that. So, may I request Anamika, ma'am? Would you like to say something, or you ask some question, ma'am? Siti, madam, here.
Thank you, madam. Thank you.
Okay. Sure. Thank you very much. Now, on behalf of our webinar, I would like to request anybody else having any question? Khatun? Khatun, do you have any question?
No, ma'am.
Yes. Okay. So now, on behalf of Mahasi College and all these webinar members, I'd like to present ma'am a small memento. Yes, ma'am. This is on behalf of this webinar, a small memento virtually we're giving to you. And I request Anamika, ma'am, can you please hand it over this virtually? Yes, Anamika, ma'am. I'd like to request Anamika, ma'am. Okay, ma'am, ma'am left. Okay, okay. So, on behalf of Maharshi College of Natural Law, the Mo College ABHIYAN, and Rover Ranger unit. And on behalf of all the staff members, I'd like to thanks, Madam, from the core of my heart. But officially, I would like to request our girls, that is none other than Sneha. She will propose a vote of thanks. So, may I request Sneha?
Yes, ma'am.
Okay. So, prior to that, let's have only one symbolic certificate presentation, e-certificate, so that everybody will know what certificates we are going to give them. First of all, I must request DIBYANSHU, Dr. Das ma'am. Can you please hand over this virtually to DIBYANSHU Padhi from BANDHBAHAL, Jharsuguda.
Yes, ma'am, sure. Congratulations, Divyanshu.
Thank you, madam.
Where is the
Ended those mantras, it was very nice.
DIBYANSHU? I want to take a photo with ma'am. So please unmute your video, please. DIBYANSHU,
Yeah, ma'am.
unmute your video. Yes, DIBYANSHU. Okay.
Please all video open. Hello.
Yes, Sonu Bhaiya, we'll do that. Just after this, I want to take a photo with Madam and DIBYANSHU. Okay. Okay, stop presenting this one. DIBYANSHU and his certificate. It's really very pleasant moment for DIBYANSHU because he is from all the way Jharsuguda with us. And we are having a small boy of 10 years old or 8 years old, but he is always, madam, with us since last 2 years. And he is attending all the webinars and very sincerely. That is the most important part. He is very sincerely attending all the webinars. Okay. I would like to take one photo. Thank you very much. Now, as for the request, Sonu Bhaiya, we'll just wait for 1 minute. I'll request SNEHA, SNEHA HALDAR, the honor student from Zoology department. She will propose a vote of thanks. Then we'll have a photograph with ma'am. And we are already late by 5 minutes, ma'am. Just 1 minute more. Yes, SNEHA.
Good evening, everyone. On behalf of Maharshi College of Natural Law, Bhubaneswar, I, Sneha Haldar, and entire fraternity of the institution, first of all, I extend a really hearty vote of thanks to our chief speaker, Dr. Shriti Das, MD, Radiation Oncologist, Apollo Hospital, our Honorable President, also Principal of Maharshi College of Natural Law, Dr. Nalini Prabha Mohapatra, and our host and convener, Dr. Namita PATNAIK, Assistant State Commissioner and Guide and Coordinator of ABHIYAN of Maharshi College of Natural Law, in collaboration of Apollo Hospital Cancer Center, Bhubaneswar. And thank you, ma'am, for giving us the opportunity to hear you today. And we are really sure that this will going to help us in our future. Thank you, ma'am.
Okay, thank you. Thank you so much. Very smart and precise. But once again, I would like to conclude this program. Prior to that, we'll have a photograph. But as a one team, this webinar team, I would like to dream up finding a cure. So feel from your heart that we will fight together to cure this. Ashok Babu, please.
Ma'am, good evening.
Ashok Babu, please mute yourself. So no one fight alone. So once we'll join our hands together, and when doctor, the technical portion is with us, so we can drive her to ma'am, and she will be very happy to get a get a patient like a breast cancer patient, and she will definitely help us. So don't be aloof. Let us start our job from today onwards. and share your knowledge to your friends, to your fraternity, and whatever knowledge you have taken from here, just try to share it. So that is the only work we want nowadays. We can do a small things, and altogether it will help us to achieve a big goal. So from today onwards, let us have, we cannot do a bigger thing, but we can hope for a bigger thing, but we can do a small things. So let us join our hands, and we have a hope, we have a strength, and we love the fraternity, we love the women community. So in that way, let us work together. So once again, I thanks to all the members and my Revered Dr. Sthiti Das, along with all the staff members of Apollo Hospital, the technical team, and the PRO Anupam. So all of them, they have joined our hands together. Even if our associate ma'am, Anamika ma'am, she joined, she was there in a camp, but she joined with our request. So all together, let us work together, at least to curb out this, just to smash away this. So what is our aim? Not to do any harm to the community, but to spread the knowledge in such a way that it stomp out the breast cancer. So thank you very much. Once again, I'd like to request all of you, please, those who have came late, please write down your name here so that you can have the certificates, e-certificates signed by Sthiti ma'am and our principal ma'am.
Namita, thank you
Let's
so
have
much
a
for arranging such an amazing program.
Shibani ma'am. Okay.
Very good.
Okay.
Good evening, Sthiti ma'am, for touching this veritable topic. It's a very stigmatic topic, but you have actually touched the nuances sensitively. Hats off.
She is from
I
Mother
think
Public School.
acceptance is the only key.
Yeah.
Exactly.
So once again, I'm also grateful to our president, the principal of our college, Maharshi College, Dr. Nalini Prabha Mahapatra ma'am, who has given us enough strength to these girls together, putting their effort together and doing this program in a very short while, ma'am. We have just decided yesterday, day before yesterday, and we did it. So we can. So again, we can. So we'll do it, ma'am. And as and when you require our help also, ma'am, you don't hesitate to ask us. We can also go to you, and offline we'll have a program so that you can also come down to our college. You will interact with our staff members. We are having 90% girls, madam. 90% girls, ladies. So we can interact also with our staff members. So with this, I conclude this program here. Prior to that, let's have a photograph with ma'am. So may I request all of you, please unmute your video, and as requested by the Sonu Bhaiya, the journalist from Bihar, we'll have a photograph and we'll share it to him. So I request all of you, those who are present over here, please unmute